Hello there, and welcome to the first official video of The Medical Madam. My name is Lindsay Harding, and I'm a licensed naturopathic doctor in Washington State, and today we're going to be talking about the digestive tract. So your digestive tract has two parts to it. It has the alimentary tract, which are the tubes that food and particles essentially pass through. And then we have the organs of digestion, which are in charge of essentially making enzymes and secreting enzymes to break down the particles of our food so that we can actually absorb and assimilate them. So digestion starts when you smell your food, which is one of the reasons it's really awesome if you cook your own food, because you get that added benefit of your body starting to prep for digestion. So when you smell your food, your stomach starts to secrete stomach acid, which is hydrochloric acid. When food enters your mouth, your saliva and the act of chewing are actually the first parts of your digestion. So digestion starts in your mouth, not in your stomach. Your saliva contains amylase and lipase. Amylase is going to start to break down carbohydrates, and lipase is going to start to break down fats a little bit. So then that food is going to travel through your esophagus and down into your stomach. We have a little sphincter at the end of the esophagus that separates the esophagus from the stomach, called the lower esophageal sphincter. The sphincter is extremely important, and we will talk about it in depth very soon. In your stomach, that hydrochloric acid will turn the food particles into a fluid called chyme. Once that chyme has reached a certain consistency, there's a sphincter that closes the gate basically between your stomach and your small intestine. Once you reach a certain consistency, that sphincter is going to open and allow that fluid, the chyme, to now pass into the small intestine, which is where you will start to actually absorb what you have eaten. So your small intestine has three parts to it. We have the duodenum, jejunum, and the ileum. Your duodenum is where the enzymes that your liver and your pancreas have created will enter to help further digest your food. The liver has been making bile salts. Those bile salts get moved into the gallbladder, and then that bile is going to be secreted into the small intestine. It's kind of like a balloon mechanism. It gets pushed out of the gallbladder into the small intestine. And then on the other side, and like back kind of behind your stomach, is your pancreas. And your pancreas has been making amylase, lipase, and protease. Amylase breaks down carbohydrates into smaller sugar molecules so that your body can use it more for fuel and then also to store. The lipase is going to work to break down fats with the bile, because that's what the bile is working on. And then protease is going to help to break down your proteins. So you see, we have a really nice array of enzymes. So if everyone is doing their job and all of them are getting made in proper amounts, you can digest your food pretty easily. So in your intestines is where you start to absorb. Okay, so everything is going to pass through the small intestines, all three sections. It's going to go through the ileocecal valve, which is, again, kind of like a sphincter. It opens and closes, and that is the separation between the small intestine and the large intestine. It is located down kind of by your appendix. And throughout the time that the chyme and the bile and everything is mixing in the intestines and moving along, it is being moved by an action called peristalsis, which is controlled by your nervous system. So it is essentially a pumping mechanism through the intestines. So once everything goes through the large intestine, it will enter the rectum and then be eliminated out through the anus. So we have 5 steps during all of this. We have ingestion, which is the act of actually putting food into your mouth or putting it into your body. Then we have digestion, which is the act of breaking up the food, so mastication, just chewing your food, and then the action from the different enzymes to break that food down into smaller particles. So your the enzymes in your saliva and in your stomach play a major role in this, as do obviously the bile and the amylase, lipase, and protease from your pancreas. So then you have absorption. So absorption is how you actually start to take in all of those nutrients. So throughout this process with all the enzymes, the nutrients are being hydrolyzed, which means they're being attached to a water molecule so that your body can absorb them. Those nutrients are going to be moved from the intestines into the bloodstream, except for fats. Fats do not get hydrolyzed. Fats are emulsified by the bile and moved into the cells from there. And then assimilation is how we actually become what we eat. So assimilation really means to bring to likeness. So think of it as those nutrients are in your blood, and the cells all around your body, different organs, structures, are gonna basically get fed from the blood. So it's the passing of the nutrient from the blood to the cell. And that's how it becomes one with you. It's essentially feeding that source or providing that nutrient. And so that is how you become what you eat. And the last step is elimination. And anything that remains undigested and unabsorbed in your intestines is going to be eliminated out in the feces. So that's digestion. Okay. So let's get into some of these systems in a little bit more detail. So starting in your mouth, because that's where digestion starts. Your mouth should have a pH, so the acidity level of your mouth should be about 7.5. This is slightly alkaline. If your mouth is too acidic, you're going to have more bacteria in your mouth, which is going to contribute to cavities. It's going to contribute to gum disease, and it's going to change the saliva in terms of the enzymes it's producing for you to be able to digest your food. Eating a diet richer in fruits and vegetables, less processed foods, really specifically sugar, is the main way to help maintain that pH level. I really do recommend, especially if you're gonna eat some sugary food, brush your teeth afterwards. Makes a really big difference. Also see your dentist. So then food's going to go through our esophagus. Our esophagus should have a neutral pH of 7. Okay, we don't want our esophagus to be too acidic, because then it burns the esophagus and we end up with things like acid reflux and then diseases that result from that being acidic over a prolonged period of time. Food enters our stomach. Our stomach is very acidic. It should have a pH of a little less than 1, like 0.5 to about 3.0. So how do we separate those? Remember that sphincter that I said is super important, the lower esophageal sphincter? That is what keeps your stomach acidity from entering your esophagus. So brings me to acid reflux. The cause of acid reflux for most people is not that you have too much acid, it's that that sphincter isn't working. So what actually tells that sphincter to close and to block the stomach contents from entering up into the esophagus? It's acid. So if you have low amounts of hydrochloric acid, that sphincter is not going to work as well, which means that those contents in your stomach, first of all, they're going to take longer to break down. So there's more risk of things fermenting in your stomach, which is going to cause more acid. But there's a much higher risk that it's going to reflux up, because there's no physical barrier anymore stopping it from refluxing up. And especially if things are fermenting, you're creating a little bit more gas, a little bit more pressure, and where's it going to go? It's going to go up. So you're going to end up with acid reflux. Really important to make sure that you're creating enough stomach acid. Zinc. Zinc is the main nutrient that is needed to make stomach acid. Ironically enough, you also need stomach acid to break down zinc. So You might need some zinc. If you have been struggling with acid reflux, see a doctor. There are a lot of really negative consequences with continued acid reflux. It can burn your esophagus, so you can end up with ulceration. You can also end up with a condition called Barrett's esophagitis, which is a precancerous condition, and it's from prolonged acid reflux. It is something you want to take seriously and address with your doctor. So then we have our intestines. You might be thinking, I totally skipped over the microbiome. I did, because the microbiome is super complex, and we're going to do a whole nother episode all on the microbiome. But in your intestines, you have the microbiome. So this is your natural and healthy grouping of bacteria. There are some fungi as well that naturally live in our GI tract. Depending on what source you look at, we have 400 different species. Most people have, I'll agree we have way more than that. We have probably 2,000 plus different species of bacteria that live happily and healthfully in our GI tract, and they're working symbiotically with us, helping us to break down our food and provide us with fuel in return. So it's a really nice synergistic combination. So we could spend hours on the microbiome, so I'm going to do a separate video on that. But the other thing that's going on in your intestines is peristalsis, which is how we actually move things, because the intestines are just a tube, and your digestive tract in all is about 30 feet long, so that's about 9 meters. It's a pretty long tube. How does the food know where to go? If you've ever looked at a picture of your intestines, it's like a giant maze of soft, mushy tube. Very appealing. So we have to have some sort of control to get things from one end to the other, because it's certainly not a gravity-fed system. So we have a mechanism called peristalsis. This is controlled by our nervous system, specifically our vagus nerve. And it creates an effect of squeezing behind and increasing in front of an area. So it's pushing the material through. So it widens the next entry point so that material continues to move in the correct direction. There are lots of areas where this could go wrong. It is really helpful to have movement in, specifically movement that uses the use of your legs to kind of give yourself a little bit of an abdominal massage to keep things moving in the intestines. So that's one of the reasons why walking is super helpful, especially if you suffer from like frequent gas or constipation. Movement is extremely helpful. The other thing is our hydration level, right? If we're not hydrated enough, things aren't going to move very well. We need that fluid because, like I mentioned before, all of your food is being turned into chyme, which is a liquid, and then it's being combined with bile and these other enzymes, which is breaking down further, and your intestines want to absorb some fluid, to feed your cells, to hydrate your body. So if you don't have enough fluid going through you, you're going to end up in a chronic dehydrated state where your body is actually dehydrated. Your cells are physically dehydrated, but so is your stool, because your body is trying to suck out as much moisture as possible, which is going to lead to more constipation. It's going to lead to difficulty going to the bathroom, increase your risk of hemorrhoids, as well as possible obstruction, which is a scenario in which the fecal material it can't move, it gets stuck. That is not a good scenario and is typically an emergency. All right, so let's talk about a few ways that you can test to see if your digestive tract is happy and healthy. So first of all is just to run through symptoms. Make sure that you're not having symptoms of any of these organs or systems working improperly. So first off, we're starting in the mouth, right? Do you have a lot of cavities? Do you have a gum disease? Do you have mapping of the tongue? So if you look at your tongue, does it look ulcerated anywhere, or really raw and sore in certain places? That can be a sign of nutritional deficiencies, which is typically because you're not absorbing your nutrients, which means something is wrong. If you have frequent cavities, there's probably a pH balance issue. So looking at your diet, possibly supplementation is needed, using more calcium or toothpastes that are geared towards remineralizing and increasing the pH, or just using mouthwashes that help increase the pH might be really helpful. Check with your dentist on that before you make any sort of changes. And then for your esophagus and your stomach, are you experiencing acid reflux or bloating? Do you get nauseous frequently? Do you feel like food just sits like a stone in your stomach after you eat? Those are all symptoms of low digestive enzymes and low stomach acid. So then we jump to the intestines. The intestines are probably the trickiest part to determine what's going on right versus what's going on incorrectly. This is really because we don't have great direct access to any of this. It's really deep inside of all of us. Upper endoscopies can be done to see the esophagus and the stomach and the first bit of the small intestine. Colonoscopies can be done to see the large intestine. There's not that much that can really see most of the small intestine. So how do we figure out what's going on wrong? First, you can do a transit time test. So this is looking at how quickly does food actually pass through your system. It's a really easy test, so long as you like beets. You can eat about half of a raw beet or a roasted beet, not a pickled beet. It won't digest the same way, but a raw or a roasted. I highly recommend removing the skin, because the skin doesn't break down as quickly, so it might alter your results a little bit. But eat that half beet and time out. What time did you eat it? And then pay attention to when you go to the bathroom afterwards. If your stool has a reddish color to it, typically that's from the beet. Hopefully that's from the beet and not from something else. You want that reddish color to appear between 12 and 24 hours after you consumed the beet. If you see that red color before 12 hours, that means food is moving through you pretty quickly. So you don't have enough time to really fully digest, absorb, and assimilate all of those nutrients. So you're someone who would benefit from getting in more nutrients, or talking to your doctor about ways to slow down that transit time a little bit. Maybe look at what else is going on. If that red color doesn't appear within that first 24 hours and appears later on, that's a sign that things are moving too slow. So you're someone more at risk of constipation, or more likely to have constipation, possibly depending on what you eat, how hydrated you are, all that good stuff. So aside from transit time, what else was really important that was happening in the intestines? All of our enzymes were put into the intestines. So how do we test to actually see if we're making enough enzymes to break down our food properly? The best way to test this is to do a stool test. There are testing options out there. Really specifically, there are comprehensive tests. They're not your standard tests that you're going to get from LabCorp or Quest, which unfortunately means that you possibly have to pay out of pocket to get these tests, but they're not too bad in cost. Anyways, if your stool floats, it means that you have a lot of fat in your stool, so you're not absorbing your fats very well, and that is a big issue. Remember, what digests our fats is going to be bile and then lipase, so it can be both a liver as well as a pancreas issue. You could have pancreatic insufficiency. It could be that your liver needs more support. It could just be all the enzymes as a whole. That does happen. Every system needs a little bit of support and love sometimes. Thank you so much for joining me today, going over the digestive tract. I hope you learned a lot. Subscribe to the Medical Madam for more amazing medical information and have an amazing day.